Years of cardiovascular outcome trials are showing that lower LDL levels are best, even as low as 30 to 50 milligrams per deciliter, or lower in high-risk patients. These two studies of PCSK9 inhibitors showed benefit, but the trials lasted less than 3 years each. So the Fourier-Ole extension trial added another 5 years to the 2.2-year Fourier trial. A 23% decrease in the risk of cardiovascular death was seen in the longer trial. And there you can see a 23% reduction in that risk on this chart. In the Fourier trial, patients had to have a history of heart attack or stroke or symptomatic peripheral artery disease. However, in the fall of 2025, results of this Vesalius-cv trial were given for patients with atherosclerosis but no heart attack or stroke. High-risk diabetes patients were also in the study. Then, an article appeared in the New England Journal of Medicine on January 8, 2026, about the Vesalius-cv trial. One of the principal investigators in the Vesalius-cv trial was Erin Bohula, MD, from Harvard. She appeared as a guest on several YouTube videos to discuss the design and results of the trial. The Vesalius-cv trial was a large international study with more than 12,000 participants, no history of heart attack or stroke. Patients had to have coronary artery disease, atherosclerotic cardiovascular disease, peripheral artery disease, or high-risk diabetes, like insulin use, microvascular complications, or over 10 years of diabetes. There were dual primary endpoints. A 3-point MACE was death from coronary artery disease, heart attack, or ischemic stroke. Then there was a 4-point MACE, which had the same things as the 3-point MACE, plus surgery for blocked arteries anywhere in the body. Patients were randomized to add Repatha 140 milligrams sub-Q every 2 weeks versus placebo. 87% of the patients were on a statin. The median LDL at the start of the study was about 122 milligrams percent. So definitely over 100 for the LDL. Over 2,000 patients participated in the lipid part of the study, where LDL fell from about 115 way down to 45 milligrams per deciliter after 48 weeks. There was a 25% relative risk reduction in the 3-point MACE group after 4.6 years in the patients who received Repatha. And again, MACE stands for Major Adverse Cardiovascular Events. There was also a 19% relative risk reduction in the 4-point MACE dual primary endpoint after 4.6 years in the patients who received Repatha. In the lipid subgroup, patients on usual therapy plus Repatha had their LDL lowered to a median level of 45 milligrams per deciliter. Conclusion: PCSK9 inhibition with Repatha led to a lower risk of first cardiovascular events than placebo among patients with atherosclerosis or diabetes without previous MI or stroke. So it looks like lower LDL levels are beneficial in patients with atherosclerosis or high-risk diabetes. So statins, ezetimibe, and Repatha are examples of medicines that can lower LDL. And there are other medicines that can lower LDL as well, but those are 3 common ones that are used. High-risk patients likely benefit by getting LDL down to 45 milligrams per deciliter or even lower. It says the lower LDL-C, the better. And if you get very low levels of LDL, it might even offer the possibility of regression of some of the atherosclerosis, at least for soft plaque, which is non-calcified. Be sure to work on other risk factors for atherosclerosis. Do not smoke. Keep your blood pressure at 120/80 or lower. Lose weight if you are overweight or obese. Control your blood glucose if you are a diabetic. Very important to work on those risk factors. Also, watch the videos on lipoprotein A and apolipoprotein B on my Stephen Vig YouTube channel. Everyone should get a lipoprotein a level, and most people have not done that yet. So this is Stephen Vig in San Antonio. Thanks for watching, and I hope you learned something from this video.